So we're going to do those 2 basic views of each breast.
She has spent her professional life in healthcare.
If it gets too tight, say stop.
First as an X-ray tech in the Air Force,
Stay just like that.
then in the private sector. So when Shelley Cassavan signed up for a mammogram for herself at age 40, she had no reason to think anything would be different from her normal baseline test 3 years before.
Gonna reach across.
No family history, no obvious lumps during self-exams.
Right there.
But when the images were examined, doctors gave her some stunning news. Shelley had breast cancer.
As overwhelming as it was, and as much as I wanted to just, crawl in bed and cry, I just really focused on the game plan.
That game plan included surgery and chemotherapy. Shelley's 19-year-old son became her caregiver, showing maturity beyond his years.
And I didn't want to put that on him, and little did I know he didn't want that privilege taken from him. So it was just mind-boggling, the maturity he showed.
Shelley lost her hair, but never her determination to survive and thrive.
We prayed a lot, and we reminded ourselves that we would do things one day at a time, and that's exactly what we did. So do you print them out hard copy at all anymore, or we just maintain our QC in here?
Shelley applied to work at the Baptist Breast Center at North Central Baptist Hospital. She was offered a job as associate director.
And that's when I really started looking at the Baptist mission statement and their philosophy on compassionate care. And that's when it clicked, that it's not just one person, that the whole team here is so compassionate.
Shelley is a key part of a multidisciplinary team that takes women from screening to diagnosis, through treatment, and on to survivorship. As a survivor herself, she's proud to be part of this unique approach to breast health.
I knew immediately if I could work in this center that I could have an impact on our entire city. And we're caught up on scans. I wouldn't just be clocking in and clocking out each day, that I would be part of something bigger than that. And that's exactly what I was looking for. I'm impressed.
Less than 2 years after her own cancer journey began, Shelley is doing her part to make sure other women get the screening they need. She's proud of her well-trained imaging staff and what they offer to the women who come here for care.
They're going to get the sweetest technologist with the best training, someone who's going to be compassionate, who's going to say, if it gets too tight, let me know. You're doing great. Relax. All right, go ahead and cover up. I just want to check these for quality a little better. I just want women to feel comfortable coming and getting their mammogram. That's the type of facility that I wanted to work in, and I'm so lucky to be here.
And lucky to have a second chance at a long life as a cancer survivor.